I went to the doctor. I got an MRI.
Left shoulder?
Left shoulder MRI, because it was just aching. It was weird. It just started for no reason and was aching. So he did the MRI, and he, I don't know all the right words, but a couple of rotator cuff tears.
Now, are they minor tears? Did you remember the word mild, moderate, severe on the report?
I think they're moderate.
Okay.
And he said, I guess, a labral tear.
Labral tear.
And he told me that it's one of those things that happens to men my age.
Really?
Yeah, he said it's not uncommon. It's not like I did anything. So I've been doing physical therapy, and I think it feels better.
What have you been doing for physical therapy?
I exercise with rubber bands to strengthen my shoulder blades and shoulders. But because of the way I normally sleep on my left shoulder, I've had to like compensate, sleep on the right, try to sleep on my back, and when I've been getting like neck cramps, and now my right shoulder's starting to hurt.
Well, let's talk about this for a second. Nerve-wise, we're working on the neck here, C7, yeah?
Yeah.
C7, T6, L5. Now, when we're talking about the shoulder, let's talk about the shoulder and the sits muscles and the labrum, okay?
Mm-hmm.
So, the scapula is what I'm going to be working on today, along with the spine. The labrum is that little cup right there.
Yeah.
That's the labrum. It sits in there.
Yep.
And I remember the first case I had of a labral tear. I wasn't treating the labral tear, but this lady was diagnosed with labral tear. She was told surgery. She had 2 weeks before surgery. We worked on spine, scapula. And she goes back 2 weeks later. He does his exam. He goes, it feels better. Does another MRI. It's starting to heal. There was no surgery.
Mm-hmm.
Now, why is that? What happened? If the scapula is out misaligned, right? So if it should be like this, but let's say it's like this,
Mm-hmm.
it's going to throw the entire mechanics of that
Yeah.
shoulder off. So power is one, but I have a feeling we need to fix scapula in order for this to set and hold. So let's do this. Let's go through the motion of the shoulders
Mm-hmm.
before and after the adjustment, okay?
Okay.
So let's just let me do the work.
Okay.
So as we're going through circumduction, is there any pain with that?
Okay. Right about this angle, I felt like a minor pain.
Okay. And now I'm doing passive range of motion. Passive range of motion is more ligamentous structures. I want you to watch that scapula. And you can see it's right about there. It's hiking and binding, right? Here. Okay, let's do the other side, please. Let me do the work. I mean, this one is starting up now too, dude. So it's not very smooth, right? It's kind of going like this. Let's go ahead. Now that's scapular. Number 1 is spine. Number 2 is going to be scapula. Okay? I'm on C7 spinous, inferior hand contact. There we go. Oh yeah. There. Drop the tummy. That's a piece. Hold. Relax the shoulders, please. T6, PLS. There you go. Good stuff. There you go. He's a little tight. Come on, dude. Let the shoulders go down. Good. 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 There you go. We're just setting scapula. It's nice to have an assistant to help. Don't need it, but it's always better too. Superior angle of the scapula. Deep breath in. Blow it out. There you go. One more. Deep breath in. Blow it out. There you go. Other side, please. You bring this arm here. Let me do the work. There. Deep breath in. All the way out. Clunk. Nice. Bueno. Look how it's moving now. Is it catching here, Michael?
No.
No, right? Okay. It's coming from the scapula.
I'm not getting that clicking.
Exactly. Right side. Let me set the shoulders now, okay?
Okay.
Drop it down. There. Right shoulder. Baseball. Let me do the work. Baseball style pitch. All the way down. There you go, sir. There's your labral tear correction and your rotator cuff tear correction.
Okay.
So what we need to do, we'll need to set it a few times.
Okay.
I'll need to flood it with some nutrition to build up those ligaments and muscle
Okay.
fibers. That's it. You move your arms now and tell me the difference. Tell us the difference.
I was clicking like a ratchet before.
Okay.
So right here, I feel just a little click.
Where?
So, like when I'm like
In the front or the back?
back.
Okay.
So
We'll
it's
work
a
through
lot
it.
better. But like my neck feels much better.